Imagine being stuck on an emotional roller coaster, unable to control the ups and downs. You might feel an incredible burst of energy one week, only to crash into overwhelming sadness the next. It's like constantly changing channels between different versions of yourself. If that sounds familiar, you may have wondered if you're dealing with bipolar disorder. And in our digital world, it's so easy to reach for your phone and take an online test for answers. But can a quick quiz really tell you if you have bipolar disorder? Let's dive into that question, and more, so you can make the best decisions for your mental health. What is bipolar disorder and how is it diagnosed? Bipolar disorder is a mental health condition that affects mood, energy levels, and behavior, often in extreme ways. There are two main types of episodes: manic episodes, where you feel unusually energetic or overly optimistic, and depressive episodes, where you feel low, hopeless, and fatigued. It's normal for everyone to feel up and down, but with bipolar disorder, these mood changes are severe enough to interfere with daily life. When doctors suspect bipolar disorder, they go through a multi-step process to make a diagnosis. This usually includes 1. Physical exams to rule out other causes for symptoms. 2. Lab tests for underlying medical issues, such as thyroid problems. 3. Questions about personal and family history, symptoms, and any mood changes. 4. A mental health assessment with a psychiatrist or psychologist. Unlike online tests, which only give you a snapshot based on self-reported answers, this in-depth process helps doctors form a complete picture of your mental health. What are online bipolar disorder tests? These are usually short quizzes that analyze your responses to a set of questions. Based on your answers, the test gives you a result indicating whether you might have bipolar disorder. Many of these tests are easy to find online, but they come with significant limitations. While online tests can be helpful as a starting point for people who may have symptoms of bipolar disorder, they have limits. Lack of accuracy: many tests are created without input from mental health professionals and don't always use scientifically backed questions. Oversimplification: they're not designed to assess the nuanced symptoms and complexities of mental health conditions. If you're considering an online test, make sure you're using one created or supported by a reputable mental health organization. Some online tests, such as the Mood Disorder Questionnaire, MDQ, were developed with the help of psychiatrists and psychologists to screen for bipolar disorder. But remember, even these are just screening tools, they don't provide a diagnosis. Why online tests can't diagnose bipolar disorder? When you take an online test, you're self-reporting your symptoms, often without professional guidance. While it may seem convenient, self-assessment is rarely accurate enough to make a clinical diagnosis. Here's why. Lack of context: online tests can't understand the full context of your answers. For example, if you report feeling high energy, an online test might flag this as a sign of mania. However, without a professional asking follow-up questions, there's no way to know if this is part of a pattern or just a one-off feeling. Unreliable answers: when you're alone, it's easy to misinterpret questions or misunderstand how your feelings fit into a larger pattern. A mental health professional, however, can clarify questions, helping you give more accurate answers. No professional interpretation: only a doctor or mental health professional can put your symptoms into the correct context, ruling out other conditions and determining the best treatment. Benefits of online mental health screening tools. Despite their limitations, online tests can still play a role in the bigger picture of mental health. Here are a few reasons why they might help. 1. Increased awareness: online tests can introduce people to common symptoms of bipolar disorder, making them more likely to seek help if they identify with what they read. 2. Encouraging honesty: many people feel more comfortable opening up about their mental health when they're alone. Online tests provide a space where they can answer questions freely without fear of judgment. 3. Easy access: online tests can be a quick first step, offering accessible mental health information to anyone with an internet connection. If you're in a remote area or have a hard time finding a doctor, these tests can at least help start the conversation. What should you do if you're worried about bipolar disorder? If you suspect that you might have bipolar disorder, The best step is to reach out to a doctor. Here's what they might do. Medical history. They'll ask about your personal and family history with mental health conditions. Since genetics can play a role, it's helpful to know if bipolar disorder runs in your family. Mental health evaluation. You'll discuss your symptoms in depth, including when they started, what triggers them, and how they affect your daily life. Be as open and honest as possible so the doctor can better understand your situation. Rule out other conditions. Some medical conditions can mimic symptoms of bipolar disorder, so a doctor may order tests to eliminate other possibilities, like thyroid issues. If bipolar disorder is confirmed, you'll work together on a treatment plan that may include therapy, medication, or other forms of support. What types of treatment are available? While online tests can't prescribe treatment, a doctor can create a tailored plan to help you manage bipolar disorder effectively. Treatment options include 1. Psychotherapy. Therapy provides a safe space to explore your thoughts, feelings, and behaviors. Cognitive behavioral therapy, CBT, is especially effective, helping you identify triggers and develop coping strategies for managing mood swings. 2. Medication. Medications like mood stabilizers, antipsychotics, and antidepressants may help manage bipolar disorder. A doctor can help you find the right medication and adjust doses as needed to balance effectiveness and side effects. 3. Other treatments. Electroconvulsive therapy, ECT. In some cases, ECT can help manage severe symptoms. Light therapy. People with seasonal mood changes might benefit from light therapy, especially if depressive episodes worsen in winter. Why you shouldn't rely on online tests alone. Remember, online tests are only a starting point. They can give you insight into your symptoms and encourage you to seek help, but they lack the precision of a professional diagnosis. If you think you may have bipolar disorder, the best choice is to reach out for an evaluation by a licensed mental health professional. The good news is that with proper treatment, many people with bipolar disorder lead full, productive lives, free of major mood episodes. When to seek help right away. If you're experiencing severe symptoms, such as thoughts of harming yourself or others, seek help immediately. Many mental health hotlines, such as the National Suicide Prevention Lifeline, are available to help 24/7. You can also go to the nearest emergency room. Don't wait, urgent support is always available. Conclusion: taking the first step toward a better understanding. Taking an online test might seem like a convenient way to get answers, but it's not a substitute for a professional diagnosis. Bipolar disorder is complex, but with the right diagnosis and treatment, it's manageable. Remember, mental health professionals are there to help, and by reaching out, you're taking an important step toward understanding and taking control of your mental health. If you're feeling uncertain or confused, you don't have to navigate this alone. Professional support is just a phone call or an appointment away.